Hi everyone, this is Dr. Devin Barley with Greenwich Chiropractic, and in this series we've been talking a lot about knee pain. Now we know that there are a variety of causes of knee pain, and that's because the anatomy in the knee joint is complicated. There's the cartilage, there's the tendons, the muscles, the bones. And so here are three very simple tests that you can do at home to try to hone in or identify at least a little bit the cause of your knee pain. The first test is very simple. So this is really a listening feeling test. So all you're gonna do is you're going to move your knee, bend your knee, and extend it back and forth. And what you're looking for is to hear things like clicking or popping. Are your knees cracking? Do you feel a muscle or a tendon rubbing over the bone? And if you feel that, there's a couple of reasons that that could be true. So what we know is that if you're feeling that click or pop kind of superficially, then what we know is that it's most likely patellofemoral syndrome or a tight quad that's inhibiting some of the tracking of the knee, if you feel that really on the surface of the knee. The other thing is that if you hear a lot of cracking and popping and maybe the pain is a little worse in the morning and then peters out towards the end of the day, we might be talking in the lane of arthritis, wear and tear, bone spurs. That cartilage, the meniscus, is what separates the upper leg from the lower leg and provides that cushion between the two bones so that you have nice support when you're walking, moving, or even doing athletic activities. So you want to make sure that if you're hearing almost a grinding or it feels a little bit deeper, that could be a cause of some cartilaginous issues. The other thing to think about is that when you're bending and extending your knee, we should be feeling a smooth glide. You shouldn't be feeling any clunking. You shouldn't be feeling anything that feels like it's not really gliding smoothly. And if that's the case, that can sometimes mean some ligament damage in there, which are basically the strings that kind of hold the bones together and keep things stable. So that's the first test. The second test is range of motion. So you're gonna do something similar, but you're gonna go through complete range of motion. So you're gonna bend your knee all the way, and then you're gonna extend it all the way. And what you're really looking for here is where you feel tightness in the knee. If when bending it, you might feel or hear a click or a pop, but you're feeling a lot of tightness in the the lower leg or the quad, then most likely that's really tight quad muscles, a group of quad muscles that are pulling and putting stress on the knee. If you're feeling it more into extension, then we know that this could possibly be some of the synovial fluid or the fluid in the knee joint that's swollen a little bit, or it can be tight where the calf muscles insert on the back of the knee as well. And that also includes the hamstring. So especially for those of you out there who are sitting at a desk with your knees bent for long periods of time, that is absolutely a concern, okay? And the third test, this is gonna test basically the cartilage that you have in your knee. So what you're gonna do is you're gonna stand up and you're going to kind of have a knee bent with one leg up, give yourself some support, and you're gonna twist one way and twist the other way. And you're gonna kind of go back and forth, okay? And if we look at the knee joint itself, there's two sides of cartilage. There's one on the left and one on the right. So if you're twisting and you're feeling pain on one side and not the other, then it could be that horn of the meniscus, that cartilage in the joint that started to wear down or is torn or injured. And those are three things that you can do to try to identify, okay, what exactly is the cause? Because as I mentioned before, the knee joint is complicated. There's ligaments, there's all the muscle attachments, and there's also the cartilage in the knee. So those are three very simple things that you can do at home. Thank you so much for listening. We'll see you on the next video.